In this video, I'm going to demonstrate seated spinal flexion and extension using the dry cupping technique. So we're going to focus on placing the cups onto the erector spinae group so that we can increase mobility to the spinal area. So first of all, I'm going to lift the vest top up here for Katie and just lower the shorts very slightly so that we can get to the erector spinae group, which runs either side of the vertebrae here on the back. Okay, so Katie's going to stay in this neutral position as I apply the cups. Although this is a stretching technique, we still need to apply medium to the back area, because when Katie's going to move doing the flexion and extension movement, the cups on the back will move as well. And also the medium is going to help the cups to get nice suction onto the muscle tissue. For the purposes of this video, I'm using the Physique lotion. However, it doesn't matter what type of medium you use. This is lotion, but you could use wax, you could use oil as well. So I'm just going to apply the lotion to the wider back area, making sure that I've got a bit of a coverage over all of the tissue. The lotion doesn't need to be completely massaged in like you would do for manual massage techniques. So we've got the medium onto the tissue here. So I'm using the Dong Bang vacuum cups. Okay, so I'm going to start at the bottom of the back. I can see where the vertebrae is, and I'm aiming for the muscle tissue either side of the vertebrae. So I'm placing the cup directly onto the tissue, placing the pump into the cup, and for here to start with, I've put 2 pumps into the cup. Okay. So depending on the size of your client, you might be able to get 2 or 3 of your standard size cups into the lumbar region. How are they feeling, Katie?
Yeah, they're fine.
So just check the sensitivity levels of your client to make sure that it's not feeling uncomfortable. So your client should feel some awareness of the cups and of that suction lift, but it shouldn't be painful or uncomfortable as you're placing them onto the client. So we've got 2 in the sort of thoracic and upper back region as well here. Again, these ones have been placed either side of the vertebrae. Before we start with the movement, because Katie's in this seated position, what can often happen is as soon as you start moving the body, the cups might come off. So just take that moment to check that all of these cups are on nice and securely. And if needed, you could then go back around the cups and place slightly more suction into each of these. So they've got a nice secure grip on the tissue. Inside the cups, we can see that the tissue has lifted up. So now we're ready to start with the movement technique. So initially we're going to do spinal flexion, and then we're going to move into spinal extension as well. So when we're moving the spine forwards and backwards, which is flexion and extension, this is going to help to release tension in the lumbar region or the lower back area, but also in the upper back area too. The nice thing about this seated position is that an awful lot of people, when they're suffering from lower back pain or they've got back tension, they find it difficult to do a pelvic tilt. So if we focus on sitting the client onto a couch or onto a chair and getting them to slump the back, that can help them to increase that movement. And as they slump the lower back, they're actually then creating that movement at the pelvis. Okay, so first of all, Katie, if you can sort of tuck your tailbone underneath you and slump that lower back down here, excellent, and then come back up into that neutral position. Brilliant, so that nice straight position. So imagining Katie's lifting her head up towards the ceiling and she's coming into that tall spine position. Then from here again, you're now going to slump back down, and we can see she's getting a stretch into the lower back area. Good, and then come back up into that nice tall position. And then one more time for me. So drawing that tailbone underneath, rounding the lower back here. And we'll also see that there's a stretch in the upper back too. And then we're coming back up into that nice tall position. Brilliant. She's got a little bit more movement now into the lower back area. At first, there might not be very much movement at all, but as she repeats those movements, that stretch reflex should kick in, and that will enable more movement in the muscle tissue as the muscle has relaxed. So now we're going to add flexion and extension together. So this time again, Katie's going to tuck her tailbone underneath her. She's going to round that lower back as she's really slumping down into a chair. Good. And then come back up into that tall position. And now this time she's going to focus on that tailbone. So she's moving that stomach forward and pushing her tailbone out behind her. And this is spinal extension in that seated position. Brilliant. And again, you're going to roll through into flexion. Good. And then come up tall through that neutral position and then forward into extension. Brilliant. And then one more time each way. So rolling back into flexion and then up to that tall position and into extension. Brilliant. Thank you. So this is something, if you're a therapist and you're encouraging your client to stretch in between your treatments, this is something that your client could do on their own at home. And the nice thing about doing this with the cups on is that you can teach them how to do the stretch, place the cups on as you're teaching them how to do this stretch and this movement, so they're getting this functional release, and then they can repeat that movement at home in between your treatments. So that was our flexion and extension movement, so moving that spine forwards and back. But we can also do lateral flexion as well, which is that side to side movement, which we're going to do now. So we've got the cups in the same position, and this time, instead of moving forwards and backwards, Katie's going to move from side to side. So if you keep your hands in your lap, Katie, and then you're just going to drop that spine over to one side. So Katie will now be feeling the stretch at this side, at the lateral side of the back here. And then come back up into that seated position and then over to the other side. So now Katie will be feeling the stretch in this side as well. She'll probably feel it more so in this lower back area or the lumbar area. Good, and then come back to that center position. We'll just do that one more time each side. So shoulders coming over. You can be mindful with the client, encouraging them to keep the body weight into both sides of the bottom here so we can see whether they're cheating or not. And then come back up into that center position and then over to that other side. Brilliant. Good, and then back into that center position. If that felt quite easy for the client or comfortable, then we can increase that stretch. So this time Katie's going to bring her arm up over her head. That's it, brilliant. And then she's going to come over to one side. Brilliant. Does that feel a little bit stronger? And then back to that center position, relaxing that arm down, and then over to the other side. Good. And back, and we'll do that one more time each side. So reaching that arm up within the client's comfort level, and a nice thing with these stretches is that they can take it to their point of stretch, so it's not uncomfortable for them. Then back to that center position and then over to that other side. Brilliant. Okay, and then come back to center and relax. So these are more mobility stretches. We're not holding them for a great deal of time. So we're only holding each of those stretches for about 2 to 3 seconds, if that, and we're repeating those stretches. So the cups enable that nice release in the tissue. One of the other movements that we perform in the spine is rotation. So we could also encourage the client, along with flexion and extension, we can get them to rotate as well. And again, this is an easy stretch that they can do whilst they might be seated at their desk in the middle of the day or after they've done a period of driving, if they're feeling that stiffness in the back. So again, this time either Katie can keep her hands into her lap or she can cross her arms over the opposite shoulder. So she's placing her hands onto the opposite shoulder here. Brilliant. Now literally again, Katie's going to have that nice tall position, so she's stretching her head up towards the ceiling, so the spine is in that tall position. So whenever we rotate, we want to rotate the spine in the tall position, not in a slumped position. And now Katie's literally going to rotate her spine as far around as she feels comfortable. Again, we're being mindful that we're not moving through the pelvis here. The pelvis is staying nice and planted into the couch. Brilliant. Then she's coming back to that center position and over to the other side. Good. Good, then back to that center position, and again, and over to the other side. So normally the first stretch might feel quite strong, and then after that's repeated 2 to 3 times, then back to the center, it should start to ease off and over. Brilliant. And then one more time each side. So again, lengthening through the head and rotating. Brilliant. And then over to the other side. Great. And back. Okay, and then relax those arms for me, please. But the whole time that Katie is stretching, or your client is stretching, you're keeping an eye on the colour inside the cups. One of the nice things with stretching is that when the client is doing it, is that they're using their muscles to create the movement. And we always create heat as a waste product whenever we produce that muscle contraction. And we can see that heat coming out of the tissue because these cups here are steaming up slightly. And that's quite common when you're doing some of those movement techniques. Excellent. We can see that the cupping marks aren't too dark on Katie's tissue. And some of these cups are steamed up slightly, so therefore that's evidence that Katie's been using her muscles and producing that relaxation response in the tissue. So just a quick recap there, we have done spinal flexion and extension with the cups on, and the cups are placed either side of the vertebrae on the erector spinae group. So Katie was moving forwards and backwards for flexion and extension. Then we've done lateral flexion to both sides, so coming back into that neutral position before going over to the other side. And then we've also accompanied that with the rotation movement, so Katie was moving from side to side, rotating the spine. So that's our stretching, dry cupping techniques to help to reduce tension and increase movement around the vertebrae or the wider back area.